All right, a lot of parents look for the ease that comes with putting a screen in front of their kids or putting their kids in front of a screen, but that, as you might expect, also has its drawbacks.
Definitely. A new study published in JAMA Pediatrics shows that allowing very young children to access televisions and other screens, including those cell phones, of course, could lead to sensory challenges later in childhood. And joining us now in studio to talk more about this is Fox 5 medical contributor Dr. Richard Chaffoo. Thank you so much for joining us today. So tell us, what did this study find?
Yeah, it's fascinating because what they looked at was they looked at screen time and they looked at children. This was a pretty large study. It involved almost 1,500 children that between the ages of, well, they looked at them at 12 months, at 18, and 24 months, and then again in follow-up at 36 months. And what they found was that for children of the age of 12 months and younger, any screen time whatsoever increased this issue of sensory integration issues up to over 100%. Once you got to 18 months, every hour beyond that increased the risk by 23%. So it's significant. And these are things like what we call sensory overload or sensory stimulating behavior, sensory avoidance, sensory sensitivity to maybe to loud sounds or loud noises, and then what we call low registration. And these were some children that avoided eye contact, were not necessarily responding to voices. So all this is indicative of the fact that this may have a significant effect on neurosensory development.
Is there anything that's known more long-term? Because if you think about, I mean, obviously, we were put in front of televisions, but we weren't put in front of iPads, right? So those have been around 15, 20 years at this point. So is there a longer-term view where you look at people who are maybe in their teens now and the effect it may have on them?
So I'm sure there are those studies that are going on, but you're right. And part of it, we do know, researchers, neuroscientists already understand that there is an association between some of the ADHD and the autism spectrum disorders where excess screen time has deleterious effects. But again, we're looking at what we consider the neurotypical population, which is the vast majority of the population. And what was, I think, very profound about this study was that during the elasticity, the time where the brain is really developing those neural connections. The neurons are seeking connectivity. Even a small amount of screen time can confuse the brain, can stimulate the neurons and have it much more difficult to create the normal synapses, the normal connections. What will be interesting is what you said, if there's some long-term longitudinal studies to look at that, because I'm obviously older, but I mean, but we weren't, we didn't have screens when I grew up, and television wasn't 24 hours a day, and you go outside and play, and they found definitely associations between more screen time in the older age group and increased risks of obesity, of developmental delay, of poor academic performance. So there's definitely this longer-term association.
And is there any amount of screen time that's actually okay for kids? And I'm sure that might change on ages, right?
It does, Era. So essentially what the American Academy of Pediatrics recommends that for children really under the age of 2, there should be 0 screen time. And after the age of 2, probably at max 1 to 2 hours of screen time per day. But part of the problem is that much of the education that's now done for children is done online. And so there is that, there is that concern. And then of course it's hard as a parent to monitor this, although, as parents we put screen times on. If a child is on doing their online work, what's to stop them from switching to YouTube or Google or somewhere else and doing something that maybe doesn't have an educational
For those especially young children, a lot of parents, I mean, they're working parents, and they're busy parents, right? And you put on Daniel Tiger or something that, that's fit for that age group, or something that's an educational game, whatever it may be. They might feel like they're doing the right thing. Is there a positive element to it?
So there's probably a positive element to it, but again, I think what the researchers were looking at was duration, not necessarily content. That would be another interesting study to see, what is the difference in effects. But we just know that the neural development is critical within those first 2 years of life, and stimulation by long-term, screen time we know can have some deleterious effects.
All right, good information for especially parents of young children out there to know all about, because it's easy. It's always easy to be like,
yeah, and it's inevitable. It's just all around us.
Yeah.
It's difficult.
It's hard to limit it.
All right, Dr. Stefano, thank you. Appreciate the insight.
Good to see you.